Hello, this is Valderim. Today I'm going to talk about diuretics. Diuretics increase the production of urine by blocking reabsorption of sodium and chloride in the nephron, because wherever sodium goes, water follows. They are mostly used to treat hypertension, edema caused by heart failure, and hepatic cirrhosis, as well as prevent renal failure. There are 4 different classes of diuretics. Each affects a specific part of the nephron. The 4 different classes are osmotic, which includes mannitol, loop, includes furosemide, thiazides, include hydrochlorothiazide, and potassium-sparing diuretics. There are 2 types, aldosterone antagonists, like spironolactone, and non-aldosterone antagonists, like triamterene. Our main osmotic diuretic is mannitol. It mostly affects the proximal convoluted tubule. It's a 6-carbon sugar that's not metabolized and not reabsorbed by the tubules. It works different than other diuretics. It creates an osmotic force that prevents water from being reabsorbed. The high osmotic force also draws fluid from surrounding tissues into blood vessels, so it's very good for decreasing intracranial pressure. It's used for renal failure prophylaxis, decreasing intracranial pressure within 60 to 90 minutes, and decreasing intraocular pressure. Side effects include edema, nausea, vomiting, fluid and electrolyte imbalance, and leakage of it will cause skin necrosis and edema. It's also not meant for chronic use. The main loop diuretic is furosemide. You can get it IV or as pills. It blocks reabsorption of sodium and chloride in the ascending bupennulae. It's mostly used to treat pulmonary edema caused by heart failure. In that situation, you'll get an IV, edema, hypertension, intracranial pressure, hyperkalemia. It's a very good drug for people with renal impairment. It works even if you have a decreased GFR and poor renal blood flow. It doesn't affect the effectiveness. Adverse effects include hypotension, hyponatremia, hypochloremia, hypokalemia, dehydration, ototoxicity if you push the IV too fast, hypomagnesemia, which will cause heart dysrhythmias. Now, the most important thing to do with this drug is monitor the potassium levels. It's very effective at what it does, and you lose a lot of electrolytes. Our main thiazide is hydrochlorothiazide. It blocks sodium and chloride reabsorption in the early distal convoluted tubule. You need to have an adequate renal function to be prescribed this medication, so a GFR higher than like 30. It's used to treat hypertension, edema, and diabetes insipidus, where it can reduce urine production by up to 50%. Adverse effects are pretty much the same as loop diuretics: hyponatremia, hypochloremia, hypokalemia, dehydration, hyperglycemia, hypomagnesemia. With both thiazides and loop diuretics, you should check for sulfur allergies because most are sulfur drugs. Potassium-sparing diuretics are mostly prescribed alongside other diuretics because of their ability to decrease potassium excretion. It's a really weak diuretic, so it's rarely used alone. There are 2 categories. Aldosterone antagonists include spironolactone. It inhibits the effect of aldosterone, so retain potassium and excrete sodium. It's a treatment for hypertension, edema, hyperaldosteronism, premenstrual syndrome, and polycystic ovary. Adverse effects include hyperkalemia, gynecomastia, impotence, hirsutism, and deepening of the voice. Those happen because spironolactone is a steroid derivative with a similar structure to progesterone, testosterone, and estrogen. Usually this medication also takes longer than 48 hours to start working. While you're on this drug, don't use any salt substitutes. They have a lot of potassium in them. And don't eat too many foods high in potassium. This drug is great at actually doing its job. The other category is non-aldosterone antagonists, like triamterene. These directly inhibit the sodium and potassium exchange mechanism, so you have a response within several hours. It's used to treat hypertension and edema. Side effects include hyperkalemia, nausea, vomiting, dizziness, and leg cramps. Some things to keep in mind are that if you're taking lithium and you have decreased sodium levels, then you're at increased risk of lithium toxicity. I said this before, but a lot of diuretics are sulfa drugs, so check for allergies. Besides the potassium-sparing diuretics, all of them cause significant potassium loss. Digoxin is a drug used for managing heart failure, and it's usually used in conjunction with diuretics as well. Now, hypokalemia increases the risk of digoxin toxicity. Alright, thanks for watching. Hopefully you learned something. If you want to see a video on something specific, leave a comment.